the Executive Director of WomenLift Health. Thank you so much for joining us for our first virtual speaker series event, Gender and Power in COVID-19, Why Diversity is Critical to Solving Global Health Emergencies. This is part of a new series where we'll analyze the gender and power dynamics at play today and in health emergencies and global health more broadly. We'll be speaking with exceptional leaders from across the global health community, as we have with our panel today. Some of you may know WomenLift Health, but for those who don't, we're an initiative to advance women's leadership in health through concrete action at the individual, organizational, and societal levels. We believe fundamentally that global health challenges will not be solved without greater diversity, most notably women at the decision-making table. After all, we are 50% of the population. I invite attendees to visit the website and follow us on social media for more information on our specific efforts, including the ways in which we are partnering with organizations and leaders around the world to support the advancement of these talented women leaders. Before getting started, I wanted to mention that we are aware of the security issues and harassment that's been taking place over Zoom. We have taken the necessary precautions, we think, to keep this session secure, and we will remove any unregistered guests. So our topic today, why diversity is critical to global health emergencies. We've just passed the 2 million cases mark worldwide. COVID-19 has left no continent and no community untouched. As countries grapple with its long-term effect, one thing is clear. The emergency response must integrate diverse perspectives, including those of women, to understand and tackle the complex challenges that are unfolding. While diseases don't respect borders, we do know they put certain groups at greater risk than others. In the United States, for example, we're seeing African Americans are dying at a much higher rate than those of other ethnicities and races because of geography, underlying health conditions, and steep inequalities in the health system. While early evidence shows men are physically at a higher risk of dying from COVID-19, we know that women are at greater risk for several other unique ways. From the risk of being the frontline health worker, of which women are the majority, greater than 70%, to suffering from the economic and financial consequences in more extreme ways due to earning less, holding less secure jobs, and taking on the preponderance of unpaid family care. To the really increasingly alarming reports that the stay-at-home orders, which have 2.6 million people confined to their homes, has contributed to a record increase in domestic violence in many parts of the world. Home does not mean safety for these women and girls. To solve COVID-19 and to any emergency, anticipating and acting on the immediate and the long-term issues, the direct and the unintended consequences, we must have diverse perspectives at the decision-making table. Just last week, the United Nations released a policy brief where Secretary General Antonio Guterres unequivocally called for women to be put in leadership roles with equal representation and decision-making power in all COVID planning and responses. Yet, as in many past health emergencies, women's voices are still far too often relegated to the sidelines. Today, we want to dig into this. We'll hear concrete examples of how it has played out, listen to the perspectives and insights from our speakers that might help us all move forward and learn what we can do to ensure women and other diverse groups have seats at the table and have a voice. I'll stop there so we can get into the conversation with our brilliant speakers who will be able to fill in the gaps with more global experience and perspectives and expand on these themes. Before introducing them, I wanted to go over just a few housekeeping items. First, please do send in your questions through the chat function. We'll be compiling them throughout the event so that the speakers can answer them in the Q&A session at the end. In case we don't get to all of them, we will post a written Q&A. This session is also being recorded and we will make it available on our website and social channels. Finally, if you don't already follow us, please do. Our Twitter handle is @WomenLift Health, and feel free to tag us with questions through that channel or comments about today's event. So without further ado, I'd like to welcome our speakers today. We have Dr. Ayoade Alakija, who is the former Chief Humanitarian Coordinator of Nigeria and a member of the WomenLift Health Global Advisory Board. Thank you, Ayoade, for joining us.
Thank you, Amy.
We have Dr. Joanne Liu, who is an emergency physician and the former international president of Médecins Sans Frontières, or Doctors Without Borders. And Joanne, we can't thank you enough for taking time from your shifts in the ER to speak with us today.
Good morning.
And we have Dr. Madhukar Pai, who is the director of the McGill University Global Health Program, who's been very pointed in his articles of late, calling for a change in what he's termed the global health aristocracy. Good morning, Madhu.
Hi.
So to kick us off and orient us in the context of where we are today, Joanne, I wanted to ask you to start. You've been an advisor to the Government of Canada. You're an emergency room doctor who's actively at the front lines. You've been intimately involved in delivering care during this pandemic. How has gender played a role in what you've seen with the emergency responses on the front line?
Right. Thank you very much for the question. Well, I think that the gender hasn't played enough of a role, just to say it very bluntly. So I think that we have it, I would say, a general blind spot about what is a dynamic with respect to pandemic. And the reality is women are the forefront everywhere because women are the carer. They are the carer at home and they are the carer, in our society. They are the one, who are basically, representing in the hospital here is 85% of the nurses are doctors. That being said, they don't have always a seat at the table to say what is going on. They are not, enough, I would say, involved into the decision making. So I think that it is important to highlight one of the, I would say, greatest, tragedy that is going on right now in my country and in my province. It's about the elder homes. We know that the people who are caring at beneficiaries in elder homes are more than 90% women, but they are the one who are earning 10 times less than any man in this kind of job. And so there is something, to be said about why it's happening and then why we let this happen for decades. And that's the reason why, having everybody around the table to be able, to tell, what are the needs and then making sure there's equity is fundamental and crucial. And today we're paying, the big price of having elder homes where we have a amazing, I would say, high level of mortality and morbidity. We shielded our elders, but we shielded without care.
Ayoade, so picking up on some of these points that Joanne has raised, kind of give us your perspective with this gendered lens. Are there specific areas where we can see that leadership is needed to understand and tackle how the pandemic is impacting these groups, women, nurses, healthcare workers, elder care? How do we start to fill these gaps?
Thank you, Amy. I think, completely aligning myself with what Joanne has just said about those who are affected and about, we're both medical doctors ourselves, Joanne and I, and how many, many, many of our colleagues are on the front line who are women who also have to go back home and care for families and care for children and many others. But I think it's actually much broader than that. What I see with this is that, let me pick up on your point about leadership. The countries that we're seeing around the world that are doing best with the coronavirus and COVID-19 appear to be those with women at the helm of government. We're seeing Jacinda Ardern from my neighborhood in New Zealand, in the South Pacific. We're seeing Germany, we're seeing Norway, amongst many others. And we're seeing the qualities such as compassion and such as empathy come through in the way the leadership is being, of the response, the COVID-19 response is being led. So that is one thing. And I sort of think that goes to the wider gender aspect. It goes to the, I know as you referred to, the aristocracy of global health there, but you could talk about the aristocracy of leadership globally. And the other aspect for me is that diversity is absolutely critical, not just in, be it male or female, and you mentioned and referred to diversity right at the beginning, but, diversity is critical in the fact that we need all the voices at the table. We need everybody at the table. We have a situation going on right now around the world, which Madhu and I discussed in the early stages, where we have copied and pasted global lockdown sort of policies from Canada or from Canada. I see that the link was down, but I see it's now back up. So do you want me to repeat that? We okay? Okay. So we're seeing, when I talk about diversity and why diversity matters, we're seeing a copy and paste of global policies on lockdown from the Western world, from America, from UK, from countries where people are getting $2,000 a month or $1,200 as part of a stimulus package. We're seeing those copied and pasted into the global South, into Africa, into India with 1.3 billion people. Why? Because we haven't had diverse voices at the table. Why? Because we haven't had the voices, be it of women, be it of men, be it of leaders from the global South, or be it of those who are most affected themselves, sitting up and saying that this cannot work for me. You cannot expect me to lock myself away for 5 weeks or 6 weeks on a subsistence earnings of less than $2 a day. So we speak to the female side of the gendered aspect of this, and we speak to the leadership, but we also speak to the wider diversity and the voice coming forward. We need the global South at the table. We need, be it women, men, whoever, whatever the diversity angle you're coming from, we need those voices to say that this is how I'm affected. And in time of a pandemic such as this is how my society and my community is going to get through what is going on right now. One size does not fit all. We need all sides, and we need diversity.
Thank you, Ayoade. So Madhu, I think this has been a perfect lead-in for you to share some of this perspective on what is actually the composition of leadership in global health. And that speaks to the points that Joanne and Ayoade have just raised about the required diversity, not only of sort of the women who are at the front line, who are the caregivers, being at that table, and are they? But also the global North, the global South, the diversity from that perspective as well. I know you have a few slides that are being queued up right now to take us through.
Thank you, Amie. So this is a piece that I wrote in Forbes, and seems like eons ago, but just a month ago, based on the Global Health 50/50 report, where I said global health needs to be global and more diverse. Next slide. The critical issue I think I was trying to get at in this piece, which I'm very happy that the Global Health 50/50 report provided to me, is anytime I saw that graphics that women are missing, I understood what that was about, and I'm completely supportive of it. But to me, that never was complete. I also want to know who these women are. Are they from high-income countries? Are they from low-income countries? And why does this matter? Because we're talking about global health here. We're talking about global health, and we predominantly emphasize and focus on low and middle income countries. So imagine if you had gender diversity, but everyone at the table is from a high income country. To me, that still doesn't cut it. And we folks working in global health cannot afford to only emphasize the gender lens, as important as it is. We also need to ask who is in the room and who is on the meeting, who is on the agenda, because that's how we're going to really get at the heart of global health. So take a look at this graphic. I mean, this is a simple graphic which shows of the almost 200 global health organizations around the world. Where are they headquartered? Well, almost 90% are headquartered in North America and Europe, which already tells you straight off the bat that the people in the room, in the building, people who are making decisions are not going to be those who are most affected and living in low and middle income countries. Next slide. And again, Global Health 50/50 gave me exactly what I was hoping to read all these years. Beyond the gender part, now we're learning not only are these organizations dominated by men, 70% of CEOs and board chairs are men, which isn't new because previous reports have also shown that. But now you see there's only a small, tiny proportion who are actually from low and middle income countries, and the tiniest proportion are women from low and middle income countries. So to me, bringing this intersectionality is absolutely fundamental. Otherwise, we're going to replace one problem with another and never really get to the heart of the problem. Global health cannot be equitable if it is only high income country people sitting around the table. Next slide. And this data from Women in Global Health confirms what the Global Health 50-50 has shown. Even in a pandemic situation, when it comes to global health security, again, women are missing. Women are not featured in the media, even though they're actually playing a huge role in this crisis, as Joanne just mentioned to all of us. Thank you.
Thank you, Madhu. So it's been a bit of a sobering picture that's been drawn, that there is not the diversity that we expect to see. If you could take the slides down, we'd appreciate it. There's not the diversity we'd expect to see, and that the impact of this is that we end up having not the best policies that fit the needs of different groups, but rather a one-size-fits-all, or certain policies that are dominated by defined and dominated by a small group. And the result is, I think, perhaps what we're starting to see with COVID is the many, many, many deaths and other severe impact that's being played out in country by country after country. So switching gears a little bit and looking a little bit more broadly and drawing on some of each of your experience on women's leadership, diversity, and global health, you all have accumulated decades in this. So Madhu, let's just kind of continue on the theme of what you've started here. Can you share a little bit more around why gender, in addition to kind of these other factors of having the experience base from being in a low or middle income country versus in a high income country, is absolutely critical to having more effective leadership at the highest levels of global health? You know, what are we missing when we're not tapping into this talent?
Thank you. I just wanted to show that the next slide, while that's coming up. Anytime we organize a global health event, a meeting, a panel, a commission, a committee, whatever, I think it's worthwhile asking a question: who do we want to listen to in this event or a commission? And I think we would all agree that we want to listen to people who are actually dealing with the problem on a day-by-day basis, who are suffering through this problem or crisis that we're interested in, who are closest to the problem and closest to the solution. And if you start off with that assumption and then you see who's around the room, it's stunning to see the kind of pictures that this slide will show. I mean, you walk into a room, it's a panel on women's reproductive health, and you have 6 men sitting there and talking about women's reproductive issues. I mean, that is just bonkers, and it should shock us that there isn't even the self-reflexivity within them to ask what the hell is wrong with this picture. Why are we sitting here and talking about a problem that we don't know the first thing about, right? Now, this isn't just the women issue. That's particularly egregious. And I think every one of us is starting to call out males, right? When we see a male, we are all now agitated. Even on Twitter, we said, what the hell is wrong with this picture? But I don't see the same level of reflexivity on the other side of the issue that I'm talking about. Let's say it's a panel on malaria, and you have 6 people, all from high income countries, who don't know the first thing about actually dealing with malaria, who've never seen a case of malaria, treated a patient with malaria, died of malaria, or dealt with someone who's died of malaria. Are they the right people to talk about this or lead a commission on malaria? That level of reflexivity is strikingly missing in the global health field. Even in my own field, it has taken me years to call this out in the area of tuberculosis. Who is suffering from tuberculosis and dying of TB? People predominantly in low and middle income countries. Who is conducting TB conferences? Who is on every single TB panel or Lancet commission? People in North America, people from UK, and so on and so forth. And we don't have the ability to even ask, how is this correct? And unless we start reflecting on what is wrong with this, I simply don't think we're ever going to make a progress.
Thank you, Madhu. So Yodi, I know you've been one of the top leaders for emergency preparedness in Nigeria and in Haiti. Are there barriers that you faced as a woman leader in this space? And how has that impacted the emergency response effectiveness? And I think picking up on some of Madhu's points, do you see that playing out now?
Well, we don't have enough time in the day to go through the barriers that I've faced as a woman leader dealing with crises and emergencies in various parts of the world. But I will touch on a few highlights. And I would also say, I completely agree with what Madhu's talking about in the frustrations that one faces when you're trying to have these discussions around, the health that affects, our continent, or in his case, the South Asia, or my case in Africa, or even the Pacific, which is my other home, when people have no idea exactly what they're talking about, but are the ones who are writing the papers and who are prescribing the solutions. Let me take us directly to COVID, for instance. COVID-19 is not just a health crisis. It's a multi-dimensional crisis with existential implications for many of the low middle income countries of this world. Why do I say that? I say it because what we have colliding in countries such as Nigeria at the moment, which will take me into my previous role, in my previous life, as it were, is that what we have colliding is extreme poverty, poor governance. We have a confluence of security crises, instability, fragile economies, and a totally disintegrated health and education system. We have that, we now have a global pandemic. And yet, somebody who has no idea, and as Madhu says, has no idea and has never been to a school, as many people won't believe this, but that I have, that didn't have running water and had to, shower or literally, squat over bushes in some instances before you could use the bathroom, because the bathrooms were so disgusting in some instances. So how do you hand wash with soap in those situations? How do you lock down entire communities and ask them to social distance in such situations? What Madhu is saying is, you cannot prescribe social distancing and lockdown to me because you don't understand my reality. So my reality is that your privilege is not my reality. Your privilege is that you can lock yourself away in a house. You can lock yourself away in separate rooms so that you don't get on each other's nerves. But going back to a crisis situation, for instance, in northeast Nigeria, in a tent, many of the tents that we have in that crisis, one of the world's largest humanitarian crises, 12 people live together in a single tent with no running water, with enough water. 5,000 people, sometimes I have seen personally, share 5 water points. How do they lock down? And if you don't understand, it goes back to my point earlier about, if you don't understand that situation, if you don't have that diversity at the table, then you cannot proffer the solutions. So my experience of this was indeed in dealing with a humanitarian crisis and spending a lot of my time, particularly the Nigeria example. Haiti was slightly different, but I've had the unfortunate privilege, if you like, of having to be at the helm of 2 of the world's largest humanitarian crises, both the Haiti earthquake and Nigeria. And people, you present at New York or in Geneva in front of donors who literally look at you and assume that, the cookie cutter life that they can see is the reality, and therefore the solutions that they want to bring forward are those which suit that reality. And this is why we need more voices at the table. I can't say that my challenges have been just because I'm a woman. Yes, there'd been, definitely challenges because I'm a woman, but there'd been maybe that mixed with the fact that I'm from the global South, and therefore the power dynamic. The very beleaguered Dr. Tedros at the moment, said earlier in this crisis that Africa is the most impacted, and the global South will be largely the most impacted by this crisis. We need more of those voices at the table, because we need to bring our reality to the table to proffer the right solutions.
Thank you, Yodi. So Joanne, so we're hearing it's about needing to understand the reality. And I know that you've been the leader of Médecins Sans Frontières, which is the preeminent institution addressing emergencies around the world. So what can we learn from some of those experiences of how to incorporate kind of gender or the diverse needs of different groups into an emergency response to do it right? Can you share examples from your time at MSF where you thought that sort of show this point?
Yes, sure. But before that, I would like to react to what of my colleague have said. I think, that when Madhu is saying, we have to listen to people that are living close to the problem because they're probably closer to the solution, or what Dr. Ayoade is saying about the solution needs to be tailored to the reality. And therefore knowing that the reality in the global south is the reality of the global north. But I think that one of the things that we need to ask ourselves about all those sort of manuals that we are creating is the fact that they're not conceptualized to lesson. They are conceptualized to put on a show. It is a moment of lecturing at high level, and everything is choreographed, and so therefore there is no room to listen. So it is flawed by itself, and I can say that because I've been on those high level platform, and I know that it was like basically a string of monologues, of a one-man show monologues, and you will have to sit over for several hours of listening to those monologues. So I think that until we really change the purpose of those meetings, where we are pretending that we want to address I would say a global issue, we need to change the mode of I'm not coming to lecture here, but I'm coming to share, and I'm coming to lesson, and I'm not putting on a show. So if we start just there, I think we and even if men just do that, we'll get much, much further. And I'm not someone, who is an advocate of saying that we need to have meeting, where we're going to have 90% of women and 10%. The reality is what we know is we need diversity, but we don't need, the flip side of what we have right now, because we're still going to have blind spot. So everybody needs to be there. What diversity brings is to lift the blind spot. So that's for me. I think that in terms of an experience, I'll talk about an experience of mine because it's dated, but I think it shows well the thing. It was in Congo in the late 90s, and there was the war, and then there was about 500,000 of people in Congo Brazzaville who went and hid in the Pool region for 6 months. And after 6 months, they decided to come back because they thought that peace was back. There was a humanitarian corridor, and they decided that people will walk back. People told us, don't go there, you're going to be killed as humanitarian. Basically what happened is on their way back, walking back, women got raped. It was gang rape. And there was so many rape on the journey back to Brazzaville that we could not pretend that it was not happening. But it was not part of what we were attending in a crisis time, in a conflict time. We were there to save lives. And I just remember there were so many raped women that we even put a sign at the reception desk where we were, welcoming them, saying, rape women on the right. And I just remember going back to my board in Paris and just say, we have to do something. We absolutely have to do something. Those women have been raped, it's been gang rape. We need to care for them. We need to bring, a comprehensive response to them, including the treatment of STD, but as well, ARVs prophylaxis and about the morning after pill, and being, supported by psychologists. And I was told, but Joanne, we don't die from a rape. I was speechless. I was absolutely speechless. And the thing is the fact that because we were a bunch of people and women, and we just say, this cannot happen. We pushed the envelope and we made it happen. And we as well, make sure that women were having access to termination of pregnancy. And I'm telling that story because I think that as a woman, that was a reality that was I could not, just being talked back and saying, we don't die from it. I just said, this, you can die, your soul is dying if you don't address that. And so I think this is what you need, to have everybody there, because everybody has different, I would say, sensitivity and emotion about things, and that allow you to drive things further, because that's essential. And so today, it's history, because the comprehensive package for sexual violence is right now part of the, I would say, the minimum package when you go in a crisis zone. And we are welcoming women, and we are caring for them. But I'm just telling you that if you don't have a diversity of people who will be sensitive to all of the things that happen, then you will have blind spot and you will miss the point.
Thank you, Joanne. So I think this issue, diversity, reveals the blind spots, and bringing in the people closest to the problem also brings the closest to the solution way forward. I want to build on something that Joanne just said of how at the time that she raised this, there was no positive reception. This isn't what we do. It's not our concept of death. We're not going to address these women who have been raped. But the point Joanne made, that now, apparently, this is now included as part of the kind of essential actions, essential package of what is done in these situations. And so the actions that you took at that time have actually helped change the way the policy and the approach taken in the future. And so as we're thinking about some of this now, we're seeing how women are confronted with some of these extra challenges that have been raised, how different subgroups are confronted with some of these extra challenges. Obviously, there's unbelievable uncertainty about how this pandemic will play out, but I do want to hear sort of more of these insights that you have all been raising about what we can learn and apply today, but also going forward, right? This has been an extraordinarily disruptive event around the world. Disruptions create crises. They also create some opportunities for change going forward. I know you've highlighted a few, Joanne. You've raised the issue of elder care. We've talked about sort of some of these kind of changes in policies. Ayoade, what are three ways that you believe your counterparts in charge of coordinating humanitarian responses in other countries could start to develop sort of more diverse teams, could be bringing in more of these voices that are closer to the problem and therefore closer to the solution? And what are the steps that you think we can be advocating for now?
Thank you, Amie. I think you've made really the point you've made is the point, is that this is an incredibly disruptive crisis. This is a new paradigm. We're entering a whole new epoch. Our lives will be the same again. So as you've said, there is, whilst remaining safe and ensuring that the minimum lives are lost, to shift things. But I think things will shift anyway. I think we're already beginning to see, be it in teleworking, be it in working remotely, be it in having virtual conferences, as you and I have discussed so much over the last few weeks, that things will naturally change. And with sort of the allies, people like Madhu and the male allies that we have alongside us, this time provides us with an opportunity as well, to develop those relationships and to ensure that within the pandemic such as this, I'm hesitant of sort of trying to say that, well, woe is us, because it isn't us within this pandemic. We as women are stepping forward, as women leaders are stepping forward and saying we want to proffer solutions to this crisis. It's not that, and it's not a case of, as my favorite thing, as you all well know, is that if they won't give you a seat at the table, then you get on, don't just pull up a chair, you just get on the table. I won't do it right now because it might not work so well on Zoom. But in the immediate term, gender-based violence is on the rise, because as people, are cooped up in houses, are cooped up in communities with frustrations, people who would normally be out at work, people who are managing, as they say, relationships and managing situations anyway, are in this incredibly tense crisis time where the multidimensional nature of the crisis as well, the pandemic, means that the economic situation they find themselves in often is strained. They can't just go outside. In some countries, you can't even go for a long walk to just blow off steam. And we're seeing a huge increase in gender-based violence. You know, the other day I saw a news report, a 60-something-year-old woman was killed by her husband. Everyone thought they were the perfect couple and they were fine. So these are the other gender dimensions, you know, of the crisis that we begin to see, and we begin to need to find solutions for going forward. I think for me, the wider, you know, the much broader thing is that a multidimensional crisis requires a multidimensional response that includes women, that includes diversity, that includes people who are closer to the ground. But also, you know, what I strongly feel is that this is not just a health crisis, it's a gender crisis, it's an economic crisis, it's an educational crisis. And just as we learned in the early days of HIV/AIDS, and those of you who are on this call who are old enough to remember, you know, when HIV/AIDS came about, everybody said, oh, this is a health crisis, and the health people wanted it. I remember in those days, it was very much a WHO thing. I was with UNICEF in those days, and when we tried to get in on the, you know, act, as it were, there was much pushback. But what we need right now is to understand that this is not about WHO, it's not about UNICEF, it's not about the UN, it's not about the private sector, it's about all of us. This is something that concerns everybody. It concerns male, it concerns female. So for me, the policy recommendation I would have for those managing, coordinating emergency crises going forward, or this crisis in different countries of the world, is that you need to put it all in one basket. We need a multi-agency solution for this. We need one that firmly includes women and their challenges, as well as their leadership and their strong voice. We need one that encompasses the private sector and the economic sector. We need one that encompasses health. We need to take this as an all of society approach going forward. And all of society includes half women.
Thank you, Jody. So you called Madhu our male ally, and certainly agree with that. So Madhu, as a male ally with over 2 decades experience of watching how leadership has kind of continued to play out in the global health sector, what do men need to do to make room for diverse voices, for more women, other kind of groups at the table? And I know you have slides, but you can ask to pull those up, please.
So firstly, I want to start off by saying that this isn't a theoretical exercise for me. 90% of my team are women. My students, my staff, 90% are women. And so I have to understand this, and I have to make an effort to do better. So, and we already spoke about, these sorts of meetings dominated by men and dominated by men from high income countries. Can I have the next slide? So here I'm starting to, and I've written about this, and I've starting to kind of think through this a little bit better myself. So on one hand, we could say women have to quote unquote lean in or push themselves to the front of the line, get onto the table, so to speak, get a chair and sit and pull the microphone and have their voices heard. And we get that. But I'm also asking, given that older men from high income countries dominate every aspect of global health, and I'm asking whether any meaningful change will come if they do not lean out consciously, thoughtfully, and deliberately. Because right now, they're pretty much cornered every inch of the real estate in global health. And it is so tight, the stronghold, that if they don't loosen their grip, I fear that it's going to be an uphill battle for voices from the global south and for women to even be heard in this situation. So, and how do men and those of us from high income countries, how do we lean out? I would argue that the first requirement is to wake up. Because right now, they don't even know what the problem is. They can't see it. They're sitting on an all-male panel talking about women's reproductive rights, and they are not even able to ask, what the heck is wrong with this picture? If that level of reflexivity is missing, then that means they are in a dream-like matrix state that they need to be woken out of. And this waking, especially for women, I will argue, does not happen naturally or organically. It takes deliberate effort and a lot of thought. But when you do wake up, you start seeing the problem everywhere because you've woken up. And to me, having as a male born in a patriarchal society in India, I think it has taken me years to wake up. And I will be honest about it. And it has taken me years to understand how to call this out and how to make a change in the way I do things myself. So the whole act of leaning out is very deeply dependent on one's ability to wake up. Now, how do we wake up more men? That's a real critical question. And how do we wake up more people in high income countries who don't even know how big of a stronghold or chokehold they have on every aspect of the agenda, money, finances, you name it. I mean, this is, I think, one of the biggest challenges, because it's easy to say women have to lean in. But if the whole real estate is completely taken up, then I think this will not happen unless we lean out. So, and we can start in small ways. About a year ago, I stepped down from an editorial board position in a TB journal. And I wrote to the editors and say, please replace me with a woman from a high burden, low income country. I'm not sure if they did it or not, but I tried. And I've that this picture reflects an all women panel that I led at my course when I organized it in Montreal. It takes a lot of time and effort and thought, but I just don't think it happens just like that. One needs to work at it and one needs to wake up, and it's not going to be easy. I can tell you that. And the fact that we have panel after panel with only men and only high income country folks tells me that the ability to even reflect is seriously pathologically missing in the area of global health. And calling that out again and again would be a contribution that we can all make. We are all calling out now all male sessions. Everybody is calling them out. The same reflexivity we need to bring and say, this is an all high income country panel, which is missing voices of people who are most affected. That needs to be called out as well. I think together, when both these things happen, hopefully we'll see the real diversity that global health needs and deserves. Thank
you, Madhu. We love you as a male ally here. And I think your message of being aware and being deliberate in your actions and taking those steps to help lean out to create some space for those trying to lean in is key. So Joanne, we've got a long way to go pretty clearly from the discussion we've had, from the very thought-provoking stories and comments that have been shared today. Do you have some thoughts on one or two specific issues or things that you believe need to happen in Canada or elsewhere to start to kind of create more of this diversity, to include more women's perspective and North-South perspectives going forward?
I think that I just wanted to react to some of the things that have been said. I think that to go back to COVID-19 and what we are facing right now, and it's like a multidimensional crisis. But I think just to follow up, on Dr. Ayoade thought, it's ultimately it's a test to our common humanity, and I think that's going to be quite a challenge. I'm not sure that we're gonna sort it out well, but what COVID-19 has really put in a very, very striking way is how much interconnected we are, and how much we cannot pretend that disaster happening elsewhere is not impacting us at the other side of the planet. And so what is fascinating to see that despite that is the fact that everybody has closed off and turned inward, and then try to and there's been somehow I would say an opportunity for more nationalistic spirit than anything else. But my biggest concern and what keeps me awake at night is to figure out, will our solidarity be the collateral damage of COVID-19? And I think that this is the thing that we need to deeply reflect on, because otherwise the global south will not pull through. And I don't think we should be crossing our arms and watching a disaster unfolding in front of us. So that's my deep, I would say, request that I want to put up right in front of you. Just say, how are we going to manage that together?
Thank you all. I think this has been very sobering, very, very thought-provoking. I think it's made each one of us step back and think about our own biases, our own experiences. And when we step up as a leader, when we step up to kind of figure out a problem, find a solution, how we're bringing our unique perspectives and sometimes our own blind spots to that table. And the importance of making sure that each and every one of us does what we can to create space for more diversity, to make sure that I think as Joanne was saying, it's about coming to a meeting, not to put on a show, but coming to that meeting, coming to that table to be sharing, but to be even more importantly, listening and learning and recognizing that there's more that you don't know than there is that you do. And it's through that kind of awareness and creation of space that we can start to be changing behaviors and starting to recognize the important contributions that each group needs to make to be able to tackle this extraordinary crisis. I think Joanna's point on, this is about our collective humanity, and the recognition of that is at the heart of all of this. And that's the disruption that COVID has caused in making many start to recognize it, and also recognize what will happen if we aren't tackling this problem in that way, is frightening. I want to make sure we can turn to some of the questions. We've been getting questions from from the team. I'm sorry, from the audience as we've gone. So a few. One question, I think for you, Madhu, but any of you may chime in. How do we balance allyship with leadership? How can we practically ensure that people of privilege help rather than hinder those who need their voices heard?
I think those of us who are privileged have an extraordinary agency and voice that we sometimes fail to use. For example, sometimes I get invited to be on a symposium on TB, and I look at the lineup and I say, oh my God, this is all of us who have, all the speakers are from America and Canada, and all of us are men. Something's wrong with this. We need to fix this, right? But the easiest thing for me is to say, yes, I accept to be on the panel, and I'm done. That takes me a second, and it's great for my CV. It's great for me to speak, but I haven't taken the next logical step. When I do have the privilege and the authority and the ability to pose a question and actually get that agenda changed when it's still being planned, that is where I fear a lot of people who are in privileged positions do not use that privilege well enough to actually make a change when they could. It would just take them a minute longer to be able to write that email and say, I'm happy to speak, but I don't think this is a good panel symposium for this, that, and the other reason. And that voice could be naturally taken forward. Or I want to be on this paper, but I'm not comfortable with the authors here. You're totally missing the most critical people. I mean, there was a Nature review paper, I kid you not, on Ebola, okay? It's published, go look at it. Nature review on Ebola. Of the 13 authors, I believe, only one was an African author. Now what, and all the rest were from America or Europe. What on earth do they know about Ebola? Think about it. And the fact that none of them even queried it all the way to publication scares the hell out of me, that they're not even able to use their privilege and say, something's wrong with this lineup. We got to fix this before it's even written up, right? That is where I think privileged people, especially men, especially established men who have nothing to lose. People like me who are full professors, who already made it in our lives, if we don't take that step, then who on earth will? I can't get it. right? It's one thing if I was a needy young person waiting to climb the ladder, but what about all the established people? And turns out the global health is dominated by established older men. They are the ones who can afford to take a hit and consistently make room for others, but they're still holding on to more and more power and wealth. That's what bothers me a lot.
Thank you, Madhu. And I should have said that question came from Inez Hassan. That was a fantastic response, and we all will be quoting that for quite a while. Here's a question for you, Joanne. It's from Adalola Papula. She wrote, how can storytelling be incorporated into these talks, these conferences, these action plans? I think your story that you shared about Congo was, there was a kind of a collective silence that even through this virtual media I could hear, because it was so powerful and immediately brought home what the larger point you were making. So how do we start incorporating that more?
Well, I don't think I have like a package answer, but I do think that we need to leave space for people to be able to speak, from direct experience, because you get the story when you experience something. And then right now, just to go back to the point of Madhu, if you have those established old men who think they've seen it all, but I've not experienced things that much, you will not get the storytelling. The storytelling are at the front line worker, the frontline interveners. It's not, from people sitting in an ivory tower somewhere in the London School of Hygiene or in at Stanford University. It's really the people who are, at ground zero, walking the walk. And so then you will get a good story.
Yeah. So it comes back to those who are closest to the problem are closest also to truly understanding how to tell the story and how to give a solution.
But let me just add something on this, because what I wouldn't like as well to leave, the room for is that people start to do humanitarian tourisms and then want to go and get, an experience to be able after that to tell a story.
Yeah.
Just wanted to add that.
Yodi, you
Amie, if I may, very quickly, just jump in on that one. I, again, completely agree with Joanne, but then I would. Yes, we need to tell the stories and we need the personal perspectives. And I feel very much for those who are coming up behind us, for the next generation, for the younger ones coming up, if we don't tell the stories, not just of our triumphs, not just of our successes, but also of our failures, if we don't talk about the challenges that we had, and sometimes, sometimes you get through them, sometimes you don't. It makes it impossible for, be it women or other people to come up along that chain. If we make it too rosy and people think, oh, well, you had a great time, you had a great life, you've worked in international health all your life, and here you are, you're, 42 years old and you've got a great career at some international, global health institute. But what were the challenges that you faced along the way? Where did you stumble? And then who helped you? Who was the Madhu in your life? Who was the counter Madhu? We're going to use that now, Madhu. You're going to be our reference point. Who's the Madhu in your life? And who's the counter Madhu in your life? And how did you get through? I think another really important point, I haven't spoken so much to gender, but I think another really important point is that, it's all well and fine blaming established men, but we also have to look at established women as well, who are at the top of that at the top of that pile, and who, because they had to endure whatever, I've had some who've told me that, what, he sexually harassed you? Do you know, girl, what I had to do to get to where I am? But that's not good enough. We can't accept that, so we need to look to established women as well to understand that the paradigm has shifted, and to understand that help is needed for those younger ones coming up who might be more vocal. We don't become victims, but we speak out about the challenges that we faced. And, in a world of COVID-19, the world, as I keep saying, is going to look very different going forward. An entire generation, sadly, in some countries, especially in the low and middle income countries, could die out. I'm sorry that, that sounds confronting, but that is the truth. In countries with no healthcare, in countries where people are buying ventilators, but you don't have respiratory therapists and you don't have intensivists, of course, prevention is the only cure. And without that prevention, we need to develop the next generation and make sure that they're ready to take up the challenge of global health and international development going forward. Thanks.
Thank you. So I see we're coming close to time. I'm going to give, in 1 minute, I'm going to give each of the speakers a chance to give us what's that one message they want to leave this audience with, of what actions they can do, what they can should take home from this discussion as we start thinking about ensuring greater diversity, including voices of women, to be addressing COVID and other health challenges and emergencies. I would say this has been extraordinary to hear how far we still have to go to be ensuring that there is the space for more diversity. There is even the awareness that it's necessary, and then the kinds of actions that we need to take. I think this Joanne's point that that diversity reveals the blind spots is really striking and makes one realize how we each have our own blind spots and each need to be creating room to listen to others. There's been also some encouraging of how through storytelling, through bringing in the voices of people closest to the challenges, we start to get a deeper understanding of more of what is happening and what may be better solutions. And in some cases, the challenge may be now, but some of the impacts might be felt in the future as the enormous disruption that's been created by COVID starts to play out, as we rethink health systems, rethink engagement patterns, rethink who should be at the table, and how we have alliances that give kind of greater voice to everyone. I want to just ask each of you. So the one message you really want to leave this audience with as we think about kind of tackling this problem and going forward and what they can do. Madhu, why don't we start with you? You're muted. Can you please unmute, Madhu?
So I would say men, established older men in high-income countries must wake up and consciously, deliberately lean out and create space. Otherwise, I just don't see a massive change happening in the area of global health.
Great. Yodi, your big message.
I think mine is to the broader nature of the COVID-19 pandemic and where we go after this. And I would really just say that we need to recognize the multidimensional nature of this crisis. We need to recognize that there needs to be multidimensional solutions. And we need to recognize that we need multiple agencies coming together. When I say agencies, I mean from the gender perspective, from the health perspective, from the education, from the private sector. I think we're only now beginning to as a global community to understand the gravity of what we're in, and that we're in a new paradigm and that the epoch has shifted. And for me, just as I think it was Peter Piot and various other people who started UNAIDS after the AIDS pandemic so many years ago. We're going to need something like that now. And I say to my girls, my sisters, my friends out there, that we all need to get up and make sure that we're part of that solution going forward. The global south, the lower middle income countries, we need to ensure that we are a big part of that solution going forward, because indeed the greatest impact will be felt by us. Thank you.
Thank you. And Joanne.
Wow. So after, Madhu and Dr. Yudi, what can I say? But it's a tough challenge. But I'm just going to come back to the very simple thing of for me, COVID-19 as being a very, very revealing exercise, and that's all it should be seen. And it's a test for our common humanity. And I do believe that we can pass that test. But if we want to pass that test, then it means to make sure that we are enforcing our solidarity mechanisms, that it doesn't become the collateral damage of the response to this pandemic, that we are ready, you know, to find solution where everybody has a say around the table. And it's not about fake diversity, but it's like true diversity, not token. You know, having someone like me is actually fake diversity. I'm French Canadian with some Chinese origin. So fake diversity. We need true diversity. And we need to be ready to do what we call improbable marriage of minds and ideas. You know, we need to mix, because it's, I always say that it's my favorite definition of insanity is to keep doing the same thing and hoping for different results. We need to fix that.
This has been a fantastic conversation. I can't thank our speakers enough. Dr. Ayoade Alakija, Dr. Joanne Liu, and Dr. Madhukar Pai, thank you for coming and sharing your very thought-provoking and honest perspectives on all of these and recommendations to the groups. I would ask the audience if there are other voices you want to hear from, especially from the Global South, from voices that we're not hearing from. Please let us know the type of issues you want to hear about, so that we can continue to have this series and be bringing forward extraordinary leaders like those that we've had today. Thank you all so very, very much. Bye-bye.
Thank you very much.
Thank you, Amie. Great to see you, Joanne. Bye, Madhu.